I recognize the Minister for Social Development.
Thank you, Madam Speaker. I'm pleased to rise in the House to speak to the second reading of Bill 31, an act to amend the Nursing Home Act. Madam Speaker, this new piece of legislation is another example showing that this government is flexible and responsive to changing times and takes action to mitigate risks when needed. We've learned a lot of lessons during the COVID-19 pandemic, and we are dedicated to implementing these learnings. This government wants to make a difference in the lives of New Brunswickers, and thanks to the support of this government, the Department of Social Development has implemented important changes and reform that we haven't seen in years. We've introduced new child and youth well-being legislation and social assistance reform. The Department of Social Development has also prioritized a renewed focus on retention and recruitment of care workers. And in recent years, the Government of New Brunswick has been moving forward with transformative actions to help seniors age well at home with as much independence as possible. This government is committed to providing the right services at the right time to New Brunswick seniors. As such, new nursing home admission criteria was recently established to ensure that New Brunswick seniors waiting to be admitted to a nursing home are treated equitably and to streamline the admissions process. This government also recognizes the pressures on our healthcare system and the importance of protecting our hospitals' ability to provide timely acute care services. This amendment to the Nursing Homes Act will permit the Minister to implement alternative admission criteria in exceptional circumstances for limited periods of time. This will not replace the regular admission process and will only be used in exceptional circumstances as outlined in regulation. These amendments will support seniors in New Brunswick by ensuring they can access the right service at the right place at the right time, while addressing exceptional circumstances that may arise from time to time. We are embarking on a period of unprecedented growth in our senior demographics for those aged 75 plus, the years that include the highest care needs. As of February 28th, there were 795 New Brunswickers waiting for admission to a nursing home, with approximately 50% of them waiting in hospital. Individuals that are medically discharged waiting in hospital for a nursing home bed are referred to as alternative level of care, ALC patients. When considering New Brunswick's aging population, the finite number of nursing home facilities, and the current staffing shortages among care staff, it becomes clear that the Minister needs to have flexibility to be responsive to needs as they emerge. Madam Speaker, this need recently became clear due to several hospitals being at a critical state of capacity, which, if not addressed, puts the provision of acute care services at risk. Many hospitals reached or approached a critical state of overcapacity over the course of the pandemic. A recent example of this included the Moncton City Hospital, the Georges L. Dumont University Hospital Centre, the St. John Regional Hospital, the Edmundston Regional Hospital, the Chaleur Regional Hospital, and the Dr. Everett Thomas Hospital in December of 2022. Madam Speaker, when confronted with that critical situation in hospital bed occupancy last December, the Department of Social Development amended the general regulation of the Nursing Home Act to add a provision to allow the priority admission of ALC patients to nursing homes in a period of critical state in hospitals for a period of up to 30 days, instead of the regular admission process of admitting potential residents in chronological order, whether coming from hospital, home, or community. High occupancy rates in hospitals is an example of what could be considered exceptional. However, while the Nursing Home Act includes regulation-making authority that allows the Lieutenant Governor and Council to make regulation respecting admissions of residents to nursing homes, it is silent on setting or adjusting the admission criteria to be able to respond to exceptional circumstances. And that, Mr. Speaker, is why we are here today. Government needs to have the tools needed to respond to crisis should they arise. However, Mr. Speaker, it should be noted now that this is not a new admission process for nursing homes and will not be treated as such. We do not want to reset the regular admission criteria that ensures equitable admission to nursing homes for seniors in New Brunswick. Rather, we are here to modify the regulation-making authority to allow the minister to respond effectively during exceptional circumstances. Admissions based on prioritizing hospital patients will be used for short periods only, up to a maximum of 30 days before reassessing, and will only be used in exceptional circumstances. The department will also increase home support services to individuals waiting at home for a nursing home bed when ALC admissions are prioritized to relieve pressures at hospitals in a critical state of overcapacity. Seniors should not be waiting for long periods of time in a hospital for a bed in a nursing home to become available. New Brunswick nursing homes are where the best care is offered for seniors that need it. They should be able to receive the services and care they deserve without laborious processes. Seniors are some of the most vulnerable members of our population. They are parents and grandparents. They raised us, and they built this province, and they have served it for decades. Now, we must advocate and support them. We must continue to provide the best services and programs possible to support their needs. We believe that this legislative amendment will help us fulfill this important mandate that falls not only on our government's shoulders, but on the shoulders of every citizen in this province. And that's why our government must not only provide a long-term care system that protects and supports the well-being of every senior, but one that works in tandem with the healthcare system and is easily navigated by individuals and their caregivers. That said, I'd like to take this moment to thank everyone who works in one way or another on the development of this important piece of legislation. In particular, thank you to the staff who developed the legislation, those that took on jurisdictional scans, and thanks to those who provided important feedback that helped us to inform the consent of this bill. More importantly, thank you to the frontline nursing home, hospital, and other staff involved in long-term care who worked tirelessly, including during the pandemic, to ensure that seniors are safe and that families are supported when they need help. The role of those staff is very challenging, to say the least, yet every day they strive to protect and support our seniors and their families. We look forward to passing this piece of legislation, which will help ensure the best future practice for exceptional times in New Brunswick. Thank you, Mr. Speaker.